In the back halls of Washington, there's a debate going on that could affect the health of tens of millions of patients with AIDS across the developing world. It's a back and forth on the future of a long-standing and highly successful U.S. effort to provide life-saving drugs overseas. PEPFAR, the president's emergency plan for AIDS relief. The struggle is pitting several major Christian figures and organizations against one another over one of the most controversial topics in politics, abortion. To understand how we got here, we need to go back to the George W. Bush administration.
To meet a severe and urgent crisis abroad, tonight I propose the emergency plan for AIDS relief, a work of mercy beyond all current international efforts to help the people of Africa. This comprehensive plan will prevent 7 million new AIDS infections, treat at least 2 million people with life-extending drugs, and provide humane care for millions of people suffering from AIDS.
PEPFAR is mostly focused on drug delivery. That's the main thing it does, is give people drug treatment. And it does that through local organizations on the ground, through NGOs. But those big NGOs are often working through really small local health clinics in Africa largely. And many of them are faith-based, which is part of why evangelicals have been so interested in this program and supportive of it over the years.
Today, the program spends $7 billion per year and has succeeded even more than President Bush hoped.
In the past 20 years, PEPFAR has saved 25 million lives. Thanks to the generosity of the American people, PEPFAR's investments are supporting over 20 million people on life-saving treatments and have prevented HIV infections in 5.5 million babies.
A key political reason for PEPFAR's long-lasting success?
Despite which party controls Congress or the White House, over the last 20 years, the bipartisan coalition that supports PEPFAR remains strong.
But there's a new threat to that consensus.
Ironically, the threat to PEPFAR right now is coming from one of its earliest supporters, which is Chris Smith, who's a Republican in Congress.
Smith, a devout Catholic, is among the leading opponents of abortion in Congress.
And he has concerns about abortion being funded through the program. The kind of big picture concern is that it's funding abortion. The more nuanced concern is that it's funding groups that do abortion or advocate for abortion separately from U.S. funds.
In a June letter, Smith, a Republican from New Jersey, charged that the Biden administration had politicized PEPFAR to, quote, promote abortion on demand. The letter notes that Population Services International, an international aid organization, received almost $97 million in PEPFAR support in the last 2 years for its HIV/AIDS care. The group offers abortions among its health services. The group operates in Africa, Central America, and Southeast Asia. In a statement, Population Services International says that its, quote, abortion work remains separate from U.S. government funding due to long-standing U.S. laws and regulations.
There's already amendments in place with every foreign aid bill that prevent direct funding or advocacy for abortion. But Chris Smith, one of his conditions for supporting the reauthorization of PEPFAR is that the Mexico City policy be included. And that's a policy that says that the US government will not support organizations that with their own funding are also advocating for abortion.
The Family Research Council, a major evangelical group, is among several organizations opposed to abortion who are now urging politicians to oppose reauthorizing PEPFAR without the new restrictions on abortion. But Democrats are insisting on reauthorizing the PEPFAR legislation without any new restrictions. If the two sides can't agree, the program could lose its reauthorization, relying instead on annual funding bills.
Reauthorization gives the program the kind of U.S. government seal of approval that this is a health program that's going to continue. And it means a lot for the 20 million people who are on treatment right now to know the U.S. government is saying we're going to support this program for 5 more years.
In July, former Senator Rick Santorum of Pennsylvania co-authored a column urging his conservative colleagues to reauthorize PEPFAR as before. He notes that if the program loses authorization, it would lose policies that conservatives previously insisted on, including an emphasis on abstinence to help prevent the spread of HIV, an increasingly acrimonious fight showing how a politicized Washington is having global implications. Chris Stewart, Scripps News.